back, ladies and gentlemen, talking men's health with Dr. Richard Natale of Carolina Urology Partners. He is a urologist and a men's health specialist in the Charlotte, North Carolina region. And today's topic is low testosterone. Dr. Natale, tell us real quick before we jump into our chat on low testosterone, who you are, why you're so passionate about this topic, because spoiler alert, maybe it's something that's affected you personally.
Oh, yeah, absolutely, Casey. Well, thank you for having me. Richard Natale, again, from Carolina Urology Partners here in the beautiful Charlotte, North Carolina. You know, men's health specialist is a guy, is a urologist who's really going to focus in on men's particular urologic conditions and make that their primary focus, something like low testosterone definitely being in their wheelhouse. And you're exactly right. I share this with all my patients because I want them to know that I don't just treat them because this is my job. I treat you because I understand. And I have low T. I actually was diagnosed a couple years ago with borderline, right above the low end of normal testosterone, and it's crummy. Felt bad, was fatigued, and had difficulties recovering and all this other stuff. And got treated. I feel great, and I try to bring that to my patients as well. Because in the end of the day, it's all about living life to the best you can, healthy and happy and energetic, and low T can throw a wrench in things for sure.
Yeah, I want to know all about that. So, how would you define low testosterone, first of all, and then maybe you can go into later in this conversation a little bit about how that low T has impacted your quality of life.
Oh yeah, here's the kind of story I give people, and we go into the more strict definition. I always kind of say that we always have those images maybe from I Love Lucy or the older TV shows of the grumpy old guy that sleeps on the couch and comes home from work's miserable and all the rest. And, really dawned on me. I said, that was low T, right? Low T can affect your mood, your energy, your libido, all the rest. And so we probably see a higher prevalence of it than what we really know. Because again, if you're not getting to get your care, if you're not seeking it out, we're not paying attention to this. So I would guesstimate somewhere in guys by the time we hit their 50s, about at least 10% of them truly have a clinical diagnosis of low testosterone. Now, our testosterone levels are going to decline over our lifetime to some degree. But the question is when that happens and how much it happens and how much it affects you. So the last story, and I know I get long-winded. I had a week in clinic where I'm not being facetious, it's a true story. In a week's time, I had a guy who was 23, a guy who's 33, a guy who is 63, and then there's me that when I was diagnosed, I was 43, and I'm not making those numbers up. And each one of us had a testosterone of 350. And I told the guy who's 63, I said, you're pretty well off because you have a testosterone of a guy 20 years younger than you. And I looked at the guy who's 23 and said, you need to have treatment. Those numbers are low for us. Now, the thing is that when you look at the ranges, unfortunately, you see a blood range from 260 to 1,000. So we have these big swaths of numbers that really don't make sense to us. So ultimately what I tell guys is this: low testosterone is a certain clinical cluster of symptoms: fatigue, poor libido or interest in sex, recovery and stamina issues, combined with some laboratory evidence of low testosterone. And that is either a low normal or of course a truly low level.
And I'm going to ask you a little bit more about those numbers.
Yeah.
What is that scale? What are those numbers gauging, measuring? Is that how low T is monitored, or are those numbers different for different men? Tell us about that.
Yeah. So there's kind of the standard breakdown for age where we look at men in their 20s and 30s and use that as kind of the index range of patients. And so if you use those numbers on that scale, this big broad scale from 260 on, you're looking more towards maybe about 700, 5 to 700 range, maybe a bit higher than that. That would be the more quote unquote normal reference range. The problem I have with that though is the following. And another completely unrelated but sort of related topic, I had my thyroid levels checked before I had my thyroid removed several years ago. And my numbers were on the very low end of normal. There was a way I existed at what's called a TSH level of zero point 0.5. Well, if you don't replace my thyroid hormone to meet that level, I would feel symptoms. Well, accordingly, with testosterone, the same idea. We don't take T levels on you every year as a standard blood test. We don't know where you were at 20. We assume we know, but we don't know where you were at 20, where you were at 30, where you were at 40. So the problem is sometimes that change is what really hits us. So there may be guys who drop from 700 or 800 down to 350 like I did, and they really are feeling that change. So that's where it's tough to say that there's a true norm that we're looking at. But with that being said, once we do get on treatments, I really do target that reference range of the 5 to 700 number, because we know then that at least we're sort of approaching the average of those guys in their 20s.
How would you explain or define low testosterone to someone who doesn't have a medical background, such as myself?
Yeah, I think the big one is because a lot of times we'll look at things like, oh, doc, or my erection's going to be a problem, or really even sometimes the interest in intercourse isn't a real major symptom. Sometimes it's just that energy, that it's sort of recovery. Tell this, my story about how I was diagnosed. As a surgeon, it is not uncommon for me to not sleep. Get called in the middle of the night, have to do surgery, and usually I'm very capable of functioning the next day. I might not be happy, I might be a little bit more tired, but I can make it through with very, very little sleep. I couldn't do that anymore. I was canceling office. I was really miserable. I was so exhausted. That's really what brought it to my attention. So I got my blood work and I looked at my numbers and I said, wow, 350, that's pretty low for a guy at 43 years old. That's why I went after treatment. So when I talk to guys about, what is it really mean? What does it do to us? It's just kind of that waning of our male hormone, that testosterone level that gives us all that kind of energy and the quote unquote vim and vigor. It's just a reduction in those levels to a point where you're running out of fuel, so to speak.
Understood. And how common is low testosterone?
Oh, I much like a lot of our other issues that we deal with, I'm going to guess this is underreported. And again, and with time, we're going to likely have some decline. But if you're talking about clinically significant, impactful low testosterone, at least 10% of men by the age of 50 have true clinical syndrome. That you really start working out those numbers. Those are millions of men in the country who need therapy or need intervention.
So if a man walks into your office and tells you that he is displaying some of these symptoms of low testosterone that we just talked about, what's next? What do you do?
Yeah, blood work is the first thing. I always, and I try my best to really not just focus in on testosterone, but if a guy comes in with fatigue, let's say, and says, I really think it's my T levels, a couple things that the discipline of this, and this was what's kind of crummy, is that I got to get your peak levels. So you got to go to the lab early the next day. So I get guys who come in at 10 o'clock in the morning, doc, I want to get my levels checked. And I got to wait till tomorrow. I want it by 8, 8:30, latest is 9. When I get those peak levels, that tells me where your testosterone surge really is and how high you get. So we then know, if you're low then, you're probably really low during the day. But again, not just the testosterone. I'll look at things like blood counts. Occasionally some vitamin levels, vitamin B, vitamin D, thyroid levels. I do check those for guys and want to make sure we're not skipping over something like that. With that being said, I couple blood work with history, because not everything is low testosterone. To make sure that globally there are no other symptoms that you're exhibiting that maybe make me think of another thing and go in another direction. So definitely a full comprehensive history, a good examination as a blood work are the ways I'm going to diagnose a patient.
Okay, and now low testosterone, a lot of times I associate with a sex drive. Is low testosterone the same thing as like having a low libido? And if you wouldn't mind just explaining what that is.
Yeah, it's interesting. That is the more classic symptom, right? So guys will say, I just don't feel like I want to have sex, or it doesn't matter to me. I'll give you, using my example again, if you would have asked me before I was diagnosed, do you have problems with your libido? The answer would have been, no, I don't. Didn't feel like I did. However, once I got on replacement, I went, oh yeah, I go, that I probably did. I probably had a little bit less of an interest. It sort of didn't matter to me as much anymore. I mean, certainly I liked it and I enjoy it, but the interest levels that were there, the drive started to kind of quell a little bit. So that's definitely part of that low libido stuff. And that is one of the telltale signs for sure.
And traditionally, low libido is just a lack of wanting to have sex?
Pretty much.
Got it. So, asking you more questions now along the sexual consequences of dealing with low testosterone. Does low testosterone cause erectile dysfunction? Is there any link to ED in low T?
Well, it's a great question, and I get this often. Yes and no. So the more scientific answer is there's no direct correlation between testosterone and erection function, the actual achieving of an erection. It's usually a blood flow issue or nerve-related issue. That being said, I do think that overall energy levels, interest, stamina, all of those things that kind of give us that background for an erection, if those are hurting, you're probably gonna have at least a little bit of troubles. And certainly, again, not to embarrass any listeners, or if my wife is listening, but certainly my wife reported to me that there was a difference in the quality of my erections, and I felt there was a difference as well once I was treated. So even though the other question of, hey doc, were your erections okay before you knew you had low T, I would have answered, of course. Then I sort of saw that change. So there's definitely a quality factor that's there with that. That being said, is it a direct relationship? No, but I do always screen men who have ED for testosterone issues. Certainly, it does play somewhat of a role.
Okay, and now tell me about how you would go about treating low testosterone.
There are lots of different ways to do it. Really, there are, I call it two groups. There's one that kind of stimulates your natural production of testosterone. That's a drug I'm on. Clomiphene, or Clomid, is a drug we've used for years for fertility reasons, to help improve sperm counts in men or help women who need to ovulate for pregnancy. So Clomid's a great drug. There's a related drug called HCG, a little bit more difficult to get. It's an injection. It does help stimulate our kind of natural production of testosterone. I chose Clomid because it's a pill. Very minimal side effects. I've gotten the levels I need. Now, in some men, they're either, maybe they don't do well on the Clomid, or they're not interested, or their levels are very low, or we have other reasons why we may consider replacement or supplementation. That comes in all different forms. There are pills, there are shots, patches, gels, pellets. There's even a nasal cream. All different types of ways we can give you your testosterone. The most commonly prescribed are injections and gels.
Ladies and gentlemen, you've been listening to Dr. Richard Natale. He is a urologist and men's health specialist with Carolina Urology Partners, and of course, that practice being in the Charlotte, North Carolina region. Dr. Natale, this has been great. As always, you are an open book, and us as listeners really appreciate it. I can speak for them, I know. It really does make a difference, and it really does get the word out there that we should be talking about this, and the more we talk about it, the better. So any other final thoughts before we end it here?
I agree. I tell you, if you ever remember there used to be those commercials with that, I forget what the company was, but the guy it was like a hair restoration company, and he would say, I'm not just the president, but I'm also a client. I'm not a client of myself. I do rely on the help of other doctors, but I get it. I am a client too. I don't just treat people. I understand it. I feel it. I've lived through these processes, and I think it's really important for me. It's really brought me closer to my patients because I get it. I know what it feels like. So my closing words always are, listen, this is a journey. We'll do it together. We'll work together. You tell me what you need. I can tell you what I can give you to help you get better. And as long as we're doing this together, we can make good stuff happen.
All right, and we'll encourage you to go to charlottemenshealth.com to learn more. Thank you again for your time today, Dr. Natali.
My pleasure.